I'm Congresswoman Pramila Jayapal, and I'm proud to serve Washington's 7th Congressional District in the House of Representatives, where I also serve as chair of the Congressional Progressive Caucus. Thank you to everyone here today for your tireless support of Medicare for All. I am proud to fight alongside you in this struggle, not only as the lead sponsor of the Medicare for All Act, but as someone who is fully committed to finally guaranteeing healthcare as a human right. Everyone in and nobody out. Now more than ever, as we struggle to move past the horror of the pandemic, we need to guarantee healthcare for everyone with no copays, no deductibles, and no private insurance premiums. With primary care, vision, dental, mental health, prescriptions, reproductive care, and long-term supports and services. We needed Medicare for All yesterday when nearly 100 million people were uninsured or underinsured in the richest nation on the planet. When grandparents were sitting at the kitchen table, cutting their pills in half. When parents were choosing between taking their kid to the doctor and paying the rent. When you were putting off the care you needed and the care you deserved. And sadly, some of our fellow organizers and activists didn't make it through the pandemic. In fact, it's estimated that Medicare for All could have saved more than 200,000 lives since March of 2020. So, our movement must march on for all who were lost. As the leader on Medicare for All in the House of Representatives, I am inspired by the activists that are here and those that are in the streets across the country. Thanks to all of you, we have made historic strides towards health justice and Medicare for All in recent years. I was proud to introduce the Medicare for All Act of 2021 alongside more than half of the House Democratic Caucus, including more than a dozen powerful committee chairs. Thanks to your advocacy and your pressure, we continue to add more members every single month. This landmark legislation is also endorsed by over 300 local, state, and national organizations that represent nurses, doctors, unions, racial justice organizations, and all of you are the ones who have made that possible. As good organizers, you know you can't slow down. You are calling for next steps to make Medicare for All a reality. And as a lifelong organizer who served as the National Health Policy Chair for Bernie's presidential campaign, I am with you every step of the way. The path ahead is tough as we battle well-funded campaigns that are bankrolled by the very big pharma and health insurance corporations who profit off of our pain. And I know that it sometimes feels like we're pushing boulders up mountains, but know this, we have made incredible progress. And while we continue to make our case to those in Congress, we are also winning the argument in public. Medicare for All is popular, and we're going to continue building the movement to make it the law of the land. The inside and outside organizing to pass Medicare for All works. It is powerful, it is necessary, and it is urgent. So don't stop marching. And know that I will be right alongside you every step of the way. Together, we can win Medicare for All. Together, we can create a just health system. And together, we can guarantee healthcare as a human right for everyone and no matter what.